Okay, excellent. Thank you for your patience. I appreciate that. I'm gonna move this little guy. Okay, so today we are talking about the transition from Medicaid to Medicare. And so as usual, we have this PowerPoint presentation and the workbook. Those are both available on the My SHIBA site that we just navigated to if you didn't get a hard copy or want to download either one of those documents. We hope today that you, after the session is done, that you will feel a little more confident in how the Medicaid to Medicare transition coordinates benefits, what happens on the client side, what the letters that they get and things like that, and how to provide additional assistance for the transition that they are making their way through. So I'm sure that most of you have worked with somebody who was on Apple Health and has to transition to Medicare because they're turning 65. Does anyone want to share one of their experiences with that, with a client that's going through that? Okay. Typically what I've heard is they get a letter that says they're going to be, their Apple Health is going to be discontinued because they're turning 65 and they need to enroll in Medicare, but the letters really don't tell them much more than that. And so, they probably ask their friends or neighbors or whoever and are being told, yeah, you're in Medicare, you have to pay for this, this, and this. Etc. And so they're anticipating a lot higher expenses than they're used to. And they may or may not know that there are other financial assistance programs out there that can help make up some of those costs, but there are different income requirements for qualifying for those programs. So I would imagine that a lot of your clients in this situation come to you and are a little bit apprehensive about what's going to happen with their health care. And probably sometimes maybe they'll ask you, do I really have to enroll in Medicare? Why can't I just keep Apple Health? And obviously the answer to that is they cannot. They have to, now that they're eligible for Medicare, they've got to enroll in Medicare in order to be eligible for any of the other financial assistance that they might qualify for through MSP or extra help, etc. So it is completely within our scope that we be knowledgeable of the Medicaid to Medicare transition process, that we help people navigate Medicare and understand their options, that we screen and guide and or help apply for Medicaid related programs such as MSP or extra help, and that we help people be their own best advocates. So Washington Apple Health is an umbrella program, or it's the brand name for all Washington state medical assistance programs, including Medicaid. Nationally, Medicaid is medical assistance for people with limited income and resources. These are federal and state funded programs, so each state runs its own Medicaid program with federal oversight, and states have some discretion on how the benefits are structured and delivered. For example, for our MSP programs, we do not any longer require a resource test. So that's one thing that Washington state has done that I don't know that many other states do it that way. So Medicaid programs vary a little bit from state to state. And then the two agencies that we work with In this process are the Healthcare Authority and the Department of Social and Health Services. So the Healthcare Authority administers most Washington Apple Health programs. So they do the contracting with the plans. And then the Department of Social and Health Services, they do the determinations on who's eligible for what different types of assistance there is. This is a publication. You may or may not have seen it. It's the Washington Apple Health Eligibility Overview. And it's a great little booklet to just kind of give you an overview of how Medicaid programs work in Washington State and what some of the different eligibility requirements are.
Shannon, are you rotating your slides?
Yeah, it's not going?
No.
No.
Oh my God. What is
We only see the front cover and we see your future slides off to the side, minimized.
okay? I must be sharing the wrong screen. You can see my speaker notes.
No, I couldn't see your speaker notes.
Oh,
I
okay.
could see future slides now on the left side.
Okay.
Yes.
All right. Sorry about that.
No, that's fine. Thank you.
Did anyone want to go back any slides to look at them? Okay. All right. So let's see. This isn't the one we're on. Okay, so we did that one with the booklet. And then Medicare versus Medicaid. This is on page 27 of your workbook. And it just kind of goes through the main differences between the two programs. That Medicare is health insurance for people over 65 or disabled of any income level. That Medicaid is really for people who have low income and resources. Medicare is uniform throughout the whole nation, but Medicaid programs vary by state. Medicare participants pay premiums, deductibles, and coinsurance. People on Medicaid have smaller co-payments or coinsurance or none. With Medicare, benefits are limited to hospital medical, limited preventative care, and very limited long-term care. With Medicaid programs, the benefits are much more comprehensive, including hospital, medical, long-term care, dental, transportation, etc. And then Medicaid requires a separate Part D plan for drug coverage. And if you're in Medicaid, some of those prescription drugs are included. So duly eligible individuals can choose, and duly eligible meaning people who both qualify for Medicaid and Medicare. Those folks can decide if they want to choose original Medicare or a Medicare Part C plan or a duly eligible special needs plans. And then, so just like anybody else, they have that choice. And then, we always encourage people to review their coverage options yearly. I just got an email from another volunteer this morning that her client has had a plan that went away and she's just now realizing it. So. All right, so people transitioning to Medicare might be eligible to be either categorically needy with a QMB plus or Slim B plus program. So they're categorically needy, or they might be determined to be medically needy and have a spend down. Or they might qualify for a Medicare savings program or extra help or a combination of these kinds of programs. And then it's important to note most of these programs have both income and resource limits with the exception of the MSP programs. So classic Medicaid is a term used to describe Medicaid healthcare programs by the Department of Social and Health Services. So classic rules and programs now apply. So what that means is that the income threshold is lower for people who have Medicaid. Assets and resources impact eligibility, and they may not be eligible if their assets or income is too high. And then they also often need help to apply for MSP or extra help. So we just talked about the fact that Medicare and full Medicaid coverage are dually eligible individuals. Medicare pays first for all Medicare covered services, and Medicaid pays last, covering the remaining costs after Medicare and other insurance. This is just a picture of the Provider One card that dual eligibles receive. They would have one of these cards. They would also have their Medicare card and possibly even a plan ID card if they're in an Advantage plan. They may or may not have to show these cards to whenever they go get services. So there's two parts to Medicaid in Washington State. MAGI Medicaid, or Modified Adjusted Gross Income Medicaid, that includes like the children's health insurance programs, and those plans that are available through the health insurance marketplace. The MAGI methodology considers taxable income and tax filing relationships to determine financial eligibility for Medicaid. And with few exceptions, they have no resource or asset limits. And then Medicaid eligibility for those over 65 or who have blindness or a disability is determined using a different income standard. The income standard of the SSI program and the Social Security Administration programs are the ones who determine the income limits for classic Medicaid, and that's what everyone who is over 65 is on. Does anyone have any questions? Okay. So when transitioning to Medicare, the big difference that your clients are going to see is that Medicare is now the main payer. So Medicaid is billed after Medicare is billed. And we help people choose plans and navigate the system. And then they are going under a different set of rules now because classic Medicaid is different from MAGI Medicaid. And so the income threshold is lower, assets and resources impact eligibility, and people might not be eligible for Medicaid if their income and assets are too high. So the biggest thing we can do is help them apply for the programs that they're eligible, be it MSP or extra help or full Medicaid, just depending on their situation. Household size does impact eligibility as well as assets and resources. And we help people apply even if we're not sure that they're going to qualify. So there's a saying here. I don't know if you've heard it before, but when in doubt, fill it out. So it doesn't hurt for them to apply, even if they might be close to the income or asset limit. All right, so we're here at our counseling session. In this recording, we have a client who receives a notice of MAGI Medicaid ending. So our job is to help them determine if they need to take action to enroll in Medicare or if they're going to be automatically enrolled. Uh, then we would help them apply for classic Medicaid or MSP or extra help. And after they receive a decision and they know what level of assistance they have, we can help them understand their Medicare coverage choices and make those decisions. If you want to follow along in your workbook through the transcript, that begins on page 35.
Um,
And so, oh yeah,
I just have a question in this application process for MSP, if it's clear someone's low income and can qualify. If they're trying to do that before they're 65, and like it, maybe Medicare is not starting until June, they should they should wait until like the middle of May to apply to MSP just to make sure that DSHS knows they're going to have Medicare to process that MSP application. Is that correct?
I believe, Carl, that that is correct. And they couldn't apply too early. I mean, I think when they apply too early, they're going to be denied because they're still on Magi Medicaid. So they wouldn't be approved for an MSP at that point. So they need to wait until they're on Medicare or close to that, so that DSHS has the information that they are enrolled in Medicare.
So, but if they don't want to pay that first month premium, they still need to do it before, like say it's starting June 1st, they would need to apply after the middle of May
I
for,
think it
for
needs to
MSP, right?
Yeah, well, and remember well, not with QMB, but with the Slim B and QI1, they can get their Part B premiums refunded to them, but that isn't the case with QMB. So if someone's really concerned about that, I think I don't know if I
Right.
have a good answer.
Yeah, I remember we had a DSHS person on, I don't know, a few months ago, and I believe that person was saying to do it early part within like 4 or 5 weeks and of the time. So if it's
Okay.
June 1, they can apply May 1, for instance. And they don't have to wait till the middle of May. That it seemed to be it had to do with how they process the applications in the queue. You know, if they're too old, they discard them, and if they're, but Carl, I think to be safe, it would be try to get that in there. Maybe you know I tell people or I try to get it in there like 4 weeks before,
Okay.
and of course I really haven't heard back to see if that works or not. So
Mhm.
has anybody else had any experience with this?
Shannon, did you say that other than MSP, that if things didn't get processed for a couple of months, that they would be reimbursed, but not so with MSP?
So what I was saying was that the QMBS, the Slim B program and the QI1 program, if somebody qualifies for one of those programs, they can be eligible for up to 3 months retroactive enrollment, where they would be eligible to get those 3 months of Part B premiums paid back to them. So that's kind of how that works. But
Okay.
QMB, because of the balance billing, QMB doesn't offer that. So so that's all I was really trying to say, that those benefits, those premiums can be retroactive in certain cases. All right. So
Wouldn't it also be that any expenses and those, as long as they're on Medicare, not only the premiums could be reimbursed, but their expenses could be reimbursed for those who are on Slim Bs and QI1s. Is that correct?
I'll have to look that up. I
Jim?
don't want to say anything that could be misleading, so I'm not sure.
Okay, Jim, what's your recollection on that retroactive,
I just remember the premium. I don't remember.
the bills? Okay.
Yeah, yeah. Sorry.
No.
It could very well apply. I have no recollection of that.
Okay, thanks.
Okay. Okay, so just as a precursor, this is a very basic scenario. You're probably dealing with clients who will present more complexities than this one. So it's simpler than a real life case, and also it's abbreviated. So it's an excerpt of a more complete conversation that you would probably have with your client. Why aren't you playing? Here we go.
Ring, ring, ring.
Hello.
Hi, this is Margaret with SHIBA. We help people with Medicare. Is this Jennifer?
Yes, this is Jennifer. Hey, thank you so much for calling me back.
Oh, you're welcome. How can I help you?
Well, I'm kind of in a panic. I got a letter from DSHS and I'm not exactly sure what it means. Currently, I have Medicaid, but I'm going to be starting Medicare and now I'm just not sure what to do.
Okay. Did you get a letter from DSHS saying that you have to apply for Medicare in order to keep your Medicaid benefits?
Yes, that's exactly what it says.
Okay. Your Medicaid benefits are going to change because you can have Medicare now. You might not completely lose assistance, but you must have Medicare once you can to receive any Medicaid related benefits because Medicare is going to pay first. Are you going to be turning 65 soon, or have you been on Social Security disability for almost 2 years?
I'm going to be turning 65 in July.
Okay. Have you been collecting Social Security?
Yes, I have.
Okay. Well, since you've been collecting Social Security, you should be automatically enrolled in Medicare. That means that you don't have to sign up for it. You'll just open your mailbox one day and there'll be a packet with a Medicare card and information for getting started in the mail. Then, if you don't change anything, your Medicare will start on the date printed on the card.
You know, I think I've already got it. It's that red, white, and blue card, right? It says my Part A and Part B coverage will start on July 1st.
That's it. So there should have also been some information about how it works and things like that. Have you had a chance to look at that?
I did look at it. So what I need to do then is just take this card with me to my doctor's office.
Well, maybe. You're going to have some options. Medicare will be your primary medical insurance now, and you'll have to have Medicare prescription drug coverage, but you still may get some help with costs and additional coverage from Medicaid.
What I heard is that I'm going to have to pay for my medications now that I have Medicare, and it can be a lot. Is that true?
Well, the Medicare prescription drug coverage is called Part D, like drugs. And how you get Part D will depend on how you choose to get your Medicare coverage. You'll have a couple different options, but having Medicaid or Medicare Savings Program will make you eligible for a program called Extra Help. If you didn't have Extra Help, you could have to pay a lot for the Part D plan and copays at the pharmacy when you pick up your prescriptions. But Extra Help generally covers most or all of the Part D costs for the plan, the premium, and reduces the copays to no more than about $12 for brand name drugs. and under $5 for generic drugs as long as they're covered by that plan. So it can help a lot and reduce those costs a lot.
So maybe it's not going to be so bad. That's terrific. So what do I need to do to make sure that I have this?
Well, you're going to get things set up with DSHS first. Then you can make some choices about how you want to get your medical coverage based on what level of help you get from Medicaid. Since you've got your card, did you also get a letter from Social Security saying that you might have to pay $185 for Part B?
Yes, and I'm not sure how I'm going to be able to do that.
Yeah, that's understandable. The good news is because you've been eligible for Apple Health, you're likely to be eligible for assistance that pays that Part B premium for you. Well, since you have Medicaid and your Medicare number now, you can contact DSHS, and they'll see if you're eligible for programs that are available for people with Medicare, which could be Medicaid and the Medicare savings programs. The Medicare savings programs will pay the Part B premium of $185 per month at the very least. Do you mind if I ask you a few questions about your income and household size to see if we can make a good guess at what you might be eligible for?
No, I don't mind. That's okay.
Thank you. So first, are you single or are you married?
I'm single.
Okay. And do you have any dependents?
No, not unless you count my dog.
Well, don't we wish we could count our dogs? Is your income above or below $967 a month?
My income, it's about $1,500 a month.
Okay. So based on that, it seems like you will be eligible for Medicare Savings Program, but not full Medicaid. The Medicare Savings Program will pay the Part B premium for you, and you'll be automatically enrolled in at the extra help for prescription drug coverage as well.
Oh, good. My friend told me I would lose Medicaid once I got Medicare and that I would have to pay for all my medications, all my dental, my glasses, and everything else all by myself. I was really worried.
Well, your friend is partly right, just not sharing the whole picture. Once you're on Medicare, you won't have some of the extra benefits that Medicaid has covered, like dental care or vision or transportation. But you'll have an option to get a Medicare Advantage plan that could include those benefits. You'll be able to get the same Medicare Advantage plans anyone can buy, and the assistance that you get, like the extra help, would be applied to the costs. Or you can get some special plans for people who are eligible for Medicare savings programs that have extra benefits. So you'll probably have some expenses, but much less than it would have been without the assistance.
Okay, I think I understand. So what is it I need to do?
Well, since you have your Medicare number, the best thing to do at this point is to find out what you're going to be eligible for. DSHS can tell you what you need to do to complete your new eligibility and the timing for that.
Okay, and then what do I do?
Well, after that, after you've completed your new certification, we can help you understand your options for the level of Medicaid or Medicare Savings Program assistance that you have. So once you have your eligibility, call us back in like late May for an appointment in early June. You have until the end of June to get your Medicare set up for July 1st. So we have some time, but early in the month also gives us a cushion to think about options and ask questions. Usually takes about an hour to figure out what will work or what you want to look into. Does that sound okay?
Yeah, it does. I'm okay with that. Now that I have my card, I need to call DSHS and they're going to get me set up for the Medicare Savings Program.
Yes, and they're going to do a certification appointment for you as a person with Medicare. They'll probably screen you for both Medicaid and the Medicare Savings Program. You're probably only going to get the Medicare Savings Program. That means you might get letters like the one that you got saying that you need to do this certification, and one saying you are declined Medicaid, as well as the letter saying you're approved for a Medicare Savings Program with the level. So it gets a little confusing. Don't worry about the decline for Medicaid. It's the Medicare Savings Program eligibility and start date that we are really looking for.
Okay. You know, I think they told me about this when I renewed my Medicaid last fall. So I guess in May, I should call you back and you'll help me get set up for the part with the Medicare.
Yes. And we'll explain your options for Medicare coverage and try to give you the information you need to make the best choice for you based on your needs and your preferences.
Okay. You know, I was really hoping I could get this done soon, but you're sure June isn't too late?
It's not, and it's really best to have your assistant settled so we can look for the options available for you specifically with as accurate of a picture of your needs as possible, but also with time to ask plans and medical providers questions if that's necessary. If you'd like to prepare ahead a bit, you can ask your medical providers which Medicare Advantage and Apple Health Medicare Connect plans they accept. Knowing that can help make it easier to identify your best options when you have that appointment to choose your Medicare coverage.
All right. So I'm going to call DSHS, then call SHIBA in May for an appointment in early June. And when I get my letter for the Medicare Savings Program, that's going to help with the choices I have for Medicare.
That's right. You've got this. So you might also get a letter saying that you have extra help with a start date and a plan named. Don't worry about it either, but keep it with your information in case we want to look at it as an option. Do you have any other questions?
I don't think so. No, I think I'm good.
Okay. And you know if you can call back if you have more questions in the meantime, right?
I do. Yep, I know I can call back. I really appreciate it. Thank you so much.
You're so welcome. Have a good day.
All right, bye-bye.
Bye.
All right, any comments about how the counselor did, or there's something that you would have done differently, or you really liked how she explained something? And how does it relate to the people that you've helped already in this kind of situation?
I think she might have been promising too much. I'm really careful when I talk to clients and say, well, you'll probably be just fine, or you're likely to be eligible. There's so many unknowns, and there's so many places that can get tripped up. So I'm a little concerned about that. And the other issue I was concerned about was she took at face value her income as $1,500 a month. I usually I drive into the details a bit about that, because the way people think about income, it's all over the map, and they may be thinking net versus gross, and they say, well, yeah, that's my Social Security, and I get a pension. We don't count that, right? And they'll just just leave that off the off the scale. So that would be another area where I think you need to probe a little bit when somebody comes up with an amount for their monthly income.
So do you clarify, is that net or gross, or do you have any other
Right.
sources besides Social Security? Yeah.
Exactly. Where does it come from? It may have a bearing. Is it earned income? Which, as we know, countable income, that's like half of that. The disregard, the $65 you disregard, the $20 you disregard, that sort of thing.
Yeah, that's a great point, Jim. Thank you. Anyone else?
My experience is a lot of people get confused about what we're talking when we talk about DSHS and Medicaid. Even if you're trying to be clear about it, they're still confused about the difference between Medicare and Medicaid. And so just really kind of trying to drive home, the state assistance. We really need to know clearly what your state assistance is, and then how that would work with Medicare, because they really get confused between Medicare and Medicaid. And then the other thing I probably would have done a little bit differently is also just kind of reinforcing, finding out where, from her providers, what doctors she goes to, what they accept, so that when she comes back, if we choose an MA plan, we know her providers are gonna accept it.
Yeah. Yeah, can give her a little bit of homework. Yeah. Scott, I was looking up your question while this was playing about being able to be reimbursed for other medical expenses besides premiums, and all I could find was there are certain types of Medicaid programs where you can get reimbursed for premiums plus any of the other medical expenses you might have, and there's a list of them. But I couldn't find anything definitive. It just said some Medicaid programs.
Yeah, I looked it up too. And then it reminded myself, Slim Bs and QI1s don't pay anything but the premium. They're not going to cover any back retroactive. They're only going to retroactive premiums, not medical charges. So,
Okay.
okay. So I was thinking about, medical charges with QMBs, yes, but QMBs aren't retroactive. So.
Right.
Thank you, though.
Thank you for bringing it up. All right, so to conclude today, we hope that you feel a little bit more confident explaining the transition from Medicaid to Medicare. I didn't put a poll in, but if you have any feedback about today's program, please let us know. We're still looking for stories for people that you've helped apply and get approval for MSP or extra help. I'm sure many of you have done this many times, but if you have a particular story you'd like to share about a client, or if you think one of your former clients would like to provide a testimonial, we would love to talk to them. So let me know if you've got someone in mind that you'd like to share their story with us. That would be great. So we do have a little bit of a slide or two about fraud prevention. June is Fraud Prevention Month, and so we'll be talking a little bit more about fraud prevention in the next couple of CEs. And then also Kim's got her SMP training going, and you can view past training sessions on the MyShiba YouTube channel. If you haven't been able to participate, those are available. So this first one, this scenario, we're talking about scam calls. So you probably maybe had a situation like this with one of your clients, or maybe even yourself. I know I get scam calls daily. So Mary is receiving scam calls daily at all different times of the day. She ignores them until one day she gets fed up and answers the phone. And the caller says he's a Medicare representative and wants to verify her information so they can send her a new card. She's suspicious. She says she doesn't want to share that information over the phone, but the person is relentless and even gets a little bit aggressive, saying that she'll lose her Medicare if she doesn't provide her information. So that throws her, and so she ends up giving out her information. And then when she hangs up, she realizes that she's probably been scammed. So that's a scenario. And the point is that the worst thing you can do is answer the phone. The next worst thing you can do is give out information. If you answer the phone even and then hang up without giving them information, just because you answered the phone, that's going to encourage them to keep trying. So, and I know it's really hard for people to let calls go to voicemail, but these scammers get pretty sophisticated. They can even make it look like somebody is calling maybe from a doctor's office, or like Peace Health, I think, was one that came up the other day that a scammer had tried to use a number that looked like Peace Health, or it said Peace Health, to get somebody to answer, but it was just a scam. So yeah, don't answer the phone. And if it does look legitimate, look up the organization's number and call them back. Don't use the number that comes up on your screen. Don't just hit redial, but actually look up the correct phone number if you think it's legit. So these scammers will use somebody's Medicare ID to bill Medicare for items not needed or requested by the beneficiary. And then just remember, Medicare never calls you, and you can report any calls or any other suspected fraud to Senior Medicare Patrol or Kim McKenna, or also the Federal Trade Commission. So these are all of the where to report scams, how to get a hold of Kim, where to learn more about Senior Medicare Patrol. All right, then most of these have already occurred. I'm not really sure what the Lunch and Learn is for May. But as soon as I know anything, I'll get the subject out to you. So we just had our Senior Medicare Patrol training series session 2 last week. And so on May 14th, it will be session 3. And that one is primarily about putting information into STARS about any fraud or suspected fraud cases you might get. And then here is a list of resources that we use today. That overview eligibility for Apple Health really has some good information in it. And also I wanted to point out the presentation today, at least in my opinion, was a little bit short, a little bit maybe not as in depth as you would have liked. But there is a lot of really good information in your workbook. It's got, especially in the back, it has some flow charts for if you're on Magi and you're going to Medicare, what the different steps are or scenarios could be. It's got some example letters that clients get. It's got a really good section on spend down and how that's calculated. So it would be worth your while to take a look at that when you have a minute, because there's a lot of good information in there. So that's what I've got for you today. Does anyone have any final thoughts or?
Yeah, I have a lot of questions and comments on the material. I've had my hand up for a while, so.
Oh, I'm sorry.
I
Go
don't know
ahead.
if you saw it or not, but.
No.
Okay. Well, yeah, I was thinking that there's a lot of, like you said in the handbook, there's a lot of good material, but comparing the different levels like QMB plus and QMB and categorically needy and all that, I think it would be helpful to have a table that points out the criteria, compares the criteria and the benefits of each level, because to have it in a text form is really not that convenient or that helpful, because there's so many details. To boil it down to a table would be quite helpful. Like for example, I've seen clients that they get letters from DSHS saying they're eligible for QMB. I don't think I've ever seen a letter that says you get QMB plus. So I think it would be helpful to be able to compare them side by side, every one of these different categories, and see what the criteria are and what the benefits are, so we know better how to advise them. That's a comment that I had. And then I had a couple of questions about the material. On page 25, and this is a question for myself, it says about Social Security extra help. It says that you can assist the client in filling out the application on their behalf. And my question there is, doesn't the client first need to have a SSA online account for us to be able to do that? We just can't go into socialsecurity.gov and sign them up for extra help. So I'm not sure
Yeah.
what that's referring to there.
I think she meant that you can assist them in filling out the application. But they would need to log in first, and then you
Right.
could
So
help
most
them
people
fill it
don't
out.
really have a login, either because they're
Mm.
not used to using computers or they just never got around to it.
Is
Mhm.
that,
And
Is that
it's
true?
not something you can do
Yeah.
at the spur of a moment.
is that something that's relatively new, John? Because I remember applying, you know, in past years, and there was no need. You just fill out the application and the
Oh,
information.
is that right? At
Yeah,
SSA.gov?
yeah.
I don't know. I thought to do anything on the Social Security website for someone, they
Mhm.
have to have a login because they have to know who you are.
It could be now. I haven't filled out one of
I
these
think you're
applications for
right,
quite a while.
John. I think John is right.
Okay.
You can't access it, and they kind of recently, maybe the last 6 months or so, have updated their
All right.
access even
So
more.
just my comment is that this thing about helping them sign up for SSA extra help, I don't think that's necessarily a very useful comment. Another question I had on page 35 of the material, this is where the material goes into how to, counseling, how to counsel people. And
Mhm.
under the section, understand Medicare coverage and make decisions. It says, people with extra help can enroll in or change Part D or Medicare Advantage plans at any time. SHIBA can help compare plans to ensure the best fit. I don't think that statement is correct. We had some other material in our continuing education that told us that only people that are categorically needy can change their Medicare Advantage or Part D plan at any time. And the new guidance is that they can only change it during open enrollment unless they're on full Medicaid. This is what I understand. So I'm not sure that comment is correct on page
And I'm sorry,
35.
John, what page were you on? I was trying to
Page
find.
35 at the top, near the top.
Oh, near the top. Okay. Let's see.
The
The
first
second-
bullet point.
Second bullet point down there.
Okay.
I checked the same thing, John. I raised a question about it as well.
Yeah, I'm gonna have to pull up that list of the different SEP. I don't know. I probably have it handy.
I think it's at Justice and Aging one, page 18 from the March.
Yeah, it wasn't that long ago.
My
Yeah.
check me out. I thought they could change their. Well, I'm not even going to venture a guess. It's hazy in my head.
Yeah, I think I'm the same way. I can't answer anything unless I look it up.
Yeah, I didn't. I wasn't able to go. I mean, if I dug a little more, I could probably go back and find where we had that training about that, but I don't remember the exact spot.
Oh, really?
Stop sharing.
Yeah, on a monthly basis. Right. You can change original Medicare or Medicare Advantage plan. No, that's right. I thought I'd try to find it quick.
It's a
LIS
brand new thing
individuals.
this year. It's
Yeah.
become much more restrictive, I understand.
If LIS only individuals, they no longer have a SEP to change Medicare Advantage plans on a quarterly basis, but there's a new monthly SEP to return to original Medicare and standalone PDP. So you can change on a monthly basis if you're if you if you don't have a Medicare Advantage plan. You can, or if you do have one, you can return to original Medicare. If you have LIS or extra help, that's a monthly SEP.
Okay, so if you have extra help and you're in original Medicare, you can change your standalone Part
Yes.
D plan. But,
right, and you
but
can
it
also
doesn't
go to,
say you can change your Medicare Advantage plan.
you can leave your Medicare Advantage plan and go
Oh.
to original Medicare, but you can't change your Medicare Advantage plan.
Okay, so that,
I think we should take a poll and say, let's make this more confusing.
So
I know,
I
right?
was just gonna ask you to
I'm almost
summarize.
understanding this.
So I was just gonna ask you to summarize that, Jim, because
Yeah,
Was-
LIS only individuals.
that's all
I-
we're talking about is LIS people.
Yes, and
Okay.
that you can change your Part D plan on a monthly basis, or you can leave your Medicare Advantage plan and return to original Medicare and pick up a Part D plan on a monthly basis.
Well,
But
really, you
what
can
you
only do that once.
yeah, well, you can change your Part D plan monthly, I guess.
Yes, you could. So that's the thing. You can change your Part D plan monthly via
Right.
LIS. But if you're a Medicare Advantage, you can't change it quarterly like you used to, but you can, as Jim
Right.
said, you can
Right.
go to original Medicare, pick up Part D, and every month change your Part D, theoretically.
You can't change to another Medicare Advantage plan.
That's it. You can't change to another Medicare Advantage plan.
yeah, so
One of
you're
those
right.
things.
I think you're right, John, that this is either wrong or she left something out.
Yeah.
Or,
Complete.
yeah,
Good. John, good for
Good
you
call.
for picking that up. I noticed it too, but I'd forgotten to bring it up. Thank you.
yeah.
Hey,
That
well,
NCOA chart, do you all have access to that? Because I can send it out again. It helped me understand, not that I remembered it all, but helped me understand the new special enrollment periods.
Can you
So-
send it out again? Because I'm not even sure what NCOA means.
Okay,
National-
yes, it's
National
either
Council on
NCOA or
Aging.
Justice and Aging, but one of the,
Oh, okay.
I think it was Justice and Aging,
yeah,
the one I'm looking at, the chart.
that chart.
John, are you done with your comments? Okay, just curious. I had some comments too that's somewhat related to the training, and in fact, John brought this up in our meeting earlier this month about countable income. And he was asking some questions about that in our get together up here in Whatcom County. And so I went to try to find something that was understandable, and I couldn't really get the document I was looking for. Maybe somebody can point me in the right direction, because we have a little bit of information about how you determine countable income, what your pensions are, or Social Security, and half of unearned income, or half of earned income for the individual. But from there, it can also get complicated if there's a spouse involved and they have some income, and if I remember right, it varies how much of their income gets counted depending on, are they applying for benefits as well at the same time, or the spouse is not eligible for Medicare even. So what I found was, something like in our rainbow chart, which is kind of low level, and then the regular wax, the very detailed information,
Mhm.
which it can get very complicated very quickly on how to do that. And what I'm looking for is something sort of middle ground to say what would be, like a SHIBA document that would say, well, here are your factors to consider. And if there are other factors, just throw up your hands and say you have to go to DSH for this one. We'll apply, but we don't know.
Yeah.
Has anybody found something, sort of a middle ground in terms of countable income? Am I asking the question properly?
You're asking the correct question.
Yeah.
Nobody has found anything else.
Okay, I
Yeah.
was just curious.
I'll look for something. I think the problem is that it does get very complicated.
Mhm.
And so what I've heard is that people should just put if they're doing a Washington Connection application, go ahead and list everything, and then let them figure it out.
I'll give you an
But
example. I do have a fair number where, you know, you're applying for an individual and the spouse has income. And how do you count that? Do you count it? How much are they applying as well, or are they on Medicare? And you know, that does come up. I know, I would say regularly in, you know, my counseling, you know, how you count spousal income, you know, earned income or unearned income too, you know, just where how complicated. I don't want to make it overly complicated where the, you know, we can't
mhm,
even understand that. I just was looking for some little heuristic to say, here's how we would, you know, categorize these, and if it doesn't fit within these boundaries, then, you know, go ahead and apply, but really DSHS will have to make a determination.
yeah, yeah. And I think that's a good response, Jim, but I'll see if, I feel like I've seen something like that before. I just need to figure out where I saw it.
Yeah. And when
Okay.
you go to the WACs or, you know, the Washington Code or the HCA
Mhm.
stuff, it's not really organized in such a way that it is an algorithmic in terms of say, well, if they apply here, you have to put, you know, it'll say, well, they qualify here, except in, they'll say, but see section 14, subsection 3, paragraph 49 for exceptions to this policy. You know, so then you go over there and you read that, and it'll say, well, this applies except see section 89, subsection 4, you know, paragraph A, you know, and so I don't know. At that point, I give up.
That's what one of the things that we try to really stress in our new basic training curriculum is that there is a rule and then there is an exception to the rule always. And it is this unless it's this, but if you have this. So it's never one answer for everyone. It's never
Yeah.
one answer. So I really appreciate you guys reading the book and workbook and having those questions. It's really helpful. And I just appreciate that you're engaged in this and are asking these questions, even though I can't answer some of them, but I can look them up.
Well, that's all we can ask for. That's great.
All right. Anyone else? John, do you feel good about the questions you got to ask? I'm sorry I didn't see those when you raised
Yes,
your hand.
thank you.
All right. All right. Well,
I got
yeah.
a question. So the scenario we had this morning with Noreen and the other,
Linda.
yeah, Linda, that was a scenario where the person's been on Medicaid, they got the letter, they have to transition from Magi Medicaid to classic Medicaid,
Mhm,
and they have to do it themselves because
mhm.
the healthcare authority is not going to automatically move them from one form of Medicaid to the other form of Medicaid. And she had the time to do that. And Noreen's direction was go to DSHS and take care of this.
Mhm.
A lot of the workbook was really talking about it is within the scope of our service to help people make that transition by assisting them with the Washington Connection,
Yeah.
okay, application form.
Yeah.
So would that client have been well served by just going on to Washington Connection and make the application there? Because that was not mentioned in what Noreen said. She was just sending him on to the CSO office.
Yeah.
Generally speaking, I get more people who don't know about the Medicare Savings Program, who haven't been in Medicaid, but now may qualify for the MSP. And so
Mhm,
they're doing it from scratch for the
mhm,
first time. And we send them to Washington Connection, or I also mentioned the CSO.
mhm.
But could that client have just as well been served by going to Washington Connection?
Yeah. And she did say that you want to make an appointment as somebody who's enrolling in Medicare for their Medicaid appointment. I think there are some situations where it could be faster and or easier when they go in there, but regardless, I think the Washington Connection application process works really well, or I've heard it works really well for most people, but there could be certain situations where it is best to go to a DSHS office. I don't know if that helps at all.
Yeah.
I think it also is the timing issue, Scott.
Yeah.
If she's not eligible until June, we probably don't want to do that Washington Connections
That's true.
application in early April.
Yeah.
Yeah.
Okay. Yeah, that's good. Thank you.
Yeah,
I have noticed, I don't know if this is related or not, but I've noticed like of the calls that have come in lately, there's a whole slew of them of people just calling because I received something in the mail that says that I could get help with paying for my Medicare. And that makes me think that probably a Medicare Advantage plan just sent out a sweep of mailings and that said, call this number. And every one of them that I've talked to was not close to being eligible. So I don't know if that relates or if that always happens, like every time maybe they do these periodic mailings. And
well, yeah, and well, they respond to the commercials they see on TV that says,
exactly.
you can get money back from your Medicare Advantage
Right.
plan,
Right.
that they're
But
just,
these
it's
recent ones
inundated.
were something that they received in the mail. And then I started thinking, oh, somebody probably just sent out a bulk mailing and now there's all these calls about it.
Yeah.
And call 1-800, Medicare.
Are they getting referred back to you?
Well, yeah, that's how I even know about it is they
Yeah.
get, they call 1-800 and then it goes to the zip code and then you call them back and that's why they're calling.
Yeah. Yeah, there was, they did send out a mailing a couple weeks ago for,
Okay,
it
maybe
was called
that's
a MIPA campaign, and they wanted to they sent it to low income zip codes. And I think it was like last Wednesday or Thursday, right before I had a long weekend. And they didn't send anything really out to the field till after it had gone out, which is one problem. And then the second problem is they didn't put anything on there that kind of gave people an idea of what the income limitations were.
right.
So that's another thing. So I'm gonna, Susan, I'll forward you the materials that I'm aware of that went out, so at least you can have those.
That's okay. You don't have to do that. I just thought it was interesting since
Yeah.
a bulk of these calls just came in. I thought, oh, there must have been somebody. I just assumed it was an Advantage plan, but.
Well, and I've heard those commercials too and seen those commercials, and they do say, you can save money in your Medicare Advantage plan. Call us.
Mhm.
Scott, you have your hand up?
Yeah. This is kind of a related Medicaid question. It's not directly related to the content for today, but it's related to a client I had yesterday, and I just want people to confirm what my recollection was about how Medicaid does or doesn't work with immigrants. So this was a man who was 68 years old. He was not signed up for Medicare A or B yet, was working seasonally, has a green card, but has no intentions of becoming a citizen. He's worked enough to get full Medicare benefits. I mean, he could sign up for Part A now, but he can't sign up for Part B now because he has not been employed and hasn't had a group health insurance plan. He doesn't qualify for a special enrollment period. So he'll have to defer until next January for the general enrollment period. Unless, he could get Medicaid. Now his income would make him a QMB. But my recollection is that in the immigration law, if you are sponsored by a family member or somebody, part of that sponsorship is you take financial responsibility for them until they become a citizen. And until that point, they're not eligible to get Medicaid. Now, if he was able to get Medicaid, he could get A and B right now and not pay any penalty for the 3 years that he's delayed getting into Medicare. But he's going to have a penalty for late enrollment, which will accrue until next January, through next January. Anybody else have another recollection about that conditional aspect of immigrants and it's how it does not qualify them for Medicaid?
I think, well, my recollection is trying to find my notes, but anyway, if you're a lawfully permanent resident, that just covers, you're here, you're a lawfully permanent resident.
It's a legal standing.
Yeah, and you have been here continuously for 5 years, just prior to application,
Right.
then you're good to go.
Right. And they qualify, they qualify in that score. But the question is, would they qualify? They can qualify for Medicare.
I think
Question is,
I'm talking
do they
Medicaid,
qualify for
Apple Health.
Medicaid?
Yes. My
And
recollection is yes, they do. In the
Okay.
state of Washington.
Okay. Do you know where you can direct me to confirm that?
I'm looking at a document here from the Healthcare Authority, Citizenship and Immigration Status. You can Google for it.
Okay, good. Okay.
Washington State Healthcare Authority, Citizenship and Immigration Status. And it's a chart that has, the various things. Are you lawfully here and what you're potentially eligible for?
Perfect. Okay. Because I'd like to get him in right now and do away with the penalty because they're paying between he and his wife $1,800 a month under the marketplace.
Gosh, how does
And
anyone?
here's the other one. She has Part A and she's in the marketplace. Now, my understanding was that that's not going to work. You can't have them both at the same time.
Good question.
Yeah.
But so they have free Part A?
Yes,
Or
she does, his wife.
Okay.
She's 2 years older and she has free Part A, but he
Wow.
doesn't have A or B right now.
Yeah, she's not legally.
Mm.
She can't, you can go to the marketplace if you have to pay for Part A. Otherwise, you're barred from going to the
It's
marketplace.
against the law. No, it depends on what she had first, but
Yeah.
if she had Part A first, you can't sell a marketplace plan to somebody who's already in any part of Medicare.
Right. Yeah. Good point.
Okay.
Well, anyway,
But thanks for the reference, Jim.
Yeah, I think anyway, you can look up that, and I think it extends to Medicare. I was talking about Apple Health, but which is the umbrella, so.
Okay, that'd be good.
Yeah, thanks. I'm gonna look at that too.
And it does come up, it's particularly in Whatcom County. We get lots of people
Mhm.
coming in from
Yeah.
immigration, Canada or somewhere else,
Yeah.
And the reason I stated that is because I've had clients before who were turned down from Medicaid because of that the condition through which they came into the country legally through being sponsored, usually by a family member. And there was a clause in there, you take full financial responsibility for them until they become a citizen. Well, these folks have never learned English and at their age don't intend to. So it's going to be on the family. But anyway, I'll look up and see if it's changed.
Yeah, and I'm not sure this applies. It's just, I just always went by the term lawfully permanent resident, as the thing that you look for, are they here legally and have they met that 5-year bar? Have they been here continuously for 5 years prior to?
Well, I'll let
applying?
I'll let everybody know what I find out.
Great.
All right. Great questions. I have a list of things to research. So thank you. All right, you guys, I hope you have a great day and thank you for joining me this morning. And I'll get those links updated for next month. So hopefully we won't have the same issue, but I should stop the recording too.
Thank you.
All right, thank
Yeah,
you.
thanks a lot.
Hi,
Have a
everybody.
great day.
All right.
See you. Bye, everybody.
Bye.